Hey guys, starting off with this braces update, I really just want to say thank you. I want to say thank you to all of my followers, my supporters. You have truly made something big happen in my life. Watching my videos, you'll probably notice the ads. I am a partner with YouTube. With this month's earnings, I was able to take those earnings, you guys, and get my father his headstone. And I cannot tell you how much of a weight that lifted off of my shoulders, because my mom passed away, you know, not long before my dad did, and we were just now 5 years later able to get her headstone. And you know, then my father, you know, he passed away late August of 2017, and I just now was able to get his headstone a lot sooner than I did with my mom's, because I was able to use my YouTube earnings. So I want to thank you guys so much for that. All your comments, your likes, your shares, your thumbs up, and some of you that even give me the thumbs down, those really do help. And it also helps get my videos out there to help those who are looking for advice and tips and experience in ortho, or just, you know, someone else's dental procedures and stuff, to see how things go, whether it's smoothly or difficult. And I just like to share my experience with you guys for that reason. And I enjoy doing it because I feel like I'm giving something back, and you guys have been amazing with me on this journey. Hi guys, I am headed to my dentist. It seems like it took forever to get here. Oh my goodness. So I had my dentist appointment originally set for January 31st. And then, of course, you guys know I got that rescheduled because I switched dentists. So I'm going to a more modern dentistry now, where technology is like up to date. But I am looking forward to this appointment because I'm curious to see how different they do things, because we've been going to our last dentist for quite a few years, actually since we moved to Tennessee, so probably for the last like 5 years. My appointment's at 12. It is 11:08 right now, so I'm gonna try to get there a little bit early because I know I'm gonna have paperwork to fill out, and I, you know, have some questions that I'm gonna ask the dentist and stuff about my treatment. They are very thorough from what my husband says over here, and whenever they see something that needs to be done, they like to get it done right then and there. They're going to probably see that cavity that I got back there on my lower right wisdom tooth, and that needs to get done. I really don't want to put that out, so I hope they can get me in soon to get that filled if they can't do it today. I think I might possibly have another cavity, which is why I'm trying to get there early too, because I want to be able to discuss that with her and see if it is a cavity. I don't know if they're going to be able to do x-rays or not because I'm in ortho. I'm kind of hoping that they can do that today. Maybe their technology is a little more up to par and they can. My last dentist couldn't. I've heard of some dentists, you know, from some of you on here that have commented, you know, y'all have said, hey, I'm in ortho and I've had x-rays done and I've had fillings done even being in ortho. So we'll see how it goes. I hope everything goes good. I hope I don't have any more going on than what I'm already suspecting. I will try to take you guys along with me for the ride. We'll see how everything goes and checks out, and I will definitely be updating you guys as soon as we finish up. Alright guys, so I'm finished. Really don't know what I want to do at this point. I'm actually quite disappointed because due to my decision to not have any extractions since being in ortho, is not helping me at this dentist to get my cavity filled on the wisdom tooth. She said she is not going to touch it. She does not like to mess with wisdom teeth. The only thing she wants to do is extract them. She was honest and upfront with me. She told me I could simply just go back to my other dentist and get it filled. That is what she told me, her exact word. I've got 3 cavities. They're going to do composite fillings on those. The area up here where the bracket fell off that I showed you guys, she said that is a very small area where I'm getting like slow decay. She said she'll put a filling there but she did not state that it was a cavity. She did the scaling to see if I have periodontal disease, and I don't. Everything checked out to be between a 1 and 3. They did digital x-rays and the panoramic thing that goes around your head and the bite wings. She will not do any fillings until after I'm out of ortho, so in another 2 to 4 months. So they got me scheduled to do my fillings in August, like the last Friday of August. They're gonna have me come back and do another cleaning in October, and that'll be when my 6-month cleaning is due, and I'll be out of ortho by then, hopefully. The whole situation about her not wanting to touch the cavity on my wisdom tooth kind of bums me, because she told me, she said it is a really bad cavity, and she said I don't want to touch it, and I'm like, okay. It's like telling a kid you got candy and holding it out in front of them and saying, but don't touch a piece, you know. So her telling me I can go back to my other dentist and have it filled was kind of like brushing me off, and it actually gave me a really bad negative energy. So I'm debating, should I just go ahead and reschedule to have a cleaning and get my cavities filled at my other dentist, because this visit didn't cost me anything. My insurance covered it all, but like I said, I didn't have nothing done. All I had done was x-rays and an exam. I didn't even have a cleaning done today. Yeah, and they're out the next 2 Fridays, so I couldn't get in sooner for a cleaning. I'll update you guys some more here in a little bit and let you know if I decide to stick with this dentist or go back to my old one. To be honest, my old dentist is sounding more like the go-to. Alright guys, so in today's braces update is going to be kind of all over the place because I've been all over the place. The reason for switching dentistry was to fulfill a void with a more thorough look at my teeth, because my previous dentist would not do x-rays since I am in ortho, and I kind of want to know what's going on in my mouth. And this new dentist that I went to did. And she also did not only the panoramic where it goes around your head, but they had me do the ones where you bite on the little bite wings. And then they also did these ones where they take like this digital wand thing and they look at your teeth with it, and it's got a camera on the end of it, and so they're able to take pictures of your teeth that way and get a pretty good look at what's going on. So when the dentist had come in, she had said, well, I want to know what your reason is for why you are switching dentist, and what's going on with you today, what are your concerns. And I explained to her the reason why I was switching dentist is because I was having a hard time trying to always get in during my husband's work week schedule, because his only days off are Fridays and Saturdays, and you know, at that particular dentist I stated to her, you know, y'all are open on Fridays, so it was easier for the both of us. And I also explained to her that I was not able to get x-rays done at my last orthodontist, and the hygienist explained that this dentist, she does not like to not do x-rays just because you're in ortho. She wants to know what's going on as well. So in that sense, I started to fall in love with the place. I was like, great, this is awesome. But then when she, you know, said, well, yeah, you definitely got a cavity on the wisdom tooth, which I already knew about. She said it's really bad, and she said, I'm just going to be honest with you. She said, I'm not going to touch it. She said, if anything, I would rather just pull it, extract it. And I said, well, I'm not having my teeth extracted. I am keeping my teeth. I'm in ortho, and I'm already in the finishing wire and in my last 2 to 4 months of treatment, and I've already had my teeth shaped and everything. So I don't want to go through with pulling teeth, because if I'm going to pull my wisdoms, I would have went on ahead and had my premolars pulled as well to pull everything back more. And with me going through all that trouble to have wisdoms pulled, which cost more than a premolar, it's just more invasive, and it costs more money to do that instead of just having the tooth filled, especially if it's not bothersome, it's not impacting my teeth, it's not crooked, you know, it's just there and it's got a cavity. I don't feel that it's necessary to not fill a tooth just because it's a cavity and a wisdom tooth and just pull it. I think that's a waste of money, especially, like I said, if the tooth is not bothersome. It's just an extra set of teeth that I can actually say I've been blessed with, because I actually had room for them and I had all 4 come in. and I was like 18 years old whenever they came in, and my dentist at that time said I was probably going to have issues with this one because it was growing out towards my cheek. And that one does not hurt me at all. None of my wisdom teeth have given me any problems or issues except for when they first started coming in. But once they came in and they broke through the gum tissue, they've been fine ever since. You can clearly see I had room for them. And you can also see that I've still got room behind those. So I had quite a bit of jaw room for those wisdom teeth to come in, so I want to retain those. I do not want to have them extracted. My orthodontist even agreed with me at my last adjustment and said, you know what, I think you're making a good decision. So with that being said, I am not wanting to have them pulled. And she mentioned that this is the weird thing. This is another thing that like really made me frustrated and annoyed, because when I left, they called my husband's phone, and it was actually the dentist herself, and she said, yes, is Kimberly there? This is such and such. I'm not going to put her name out there. And my husband said, well, she hasn't got home yet from the dentist. Can I ask what this is about? And she said, well, this is so-and-so, and I was just calling her. And she didn't even go into detail what it was about. So my husband called me on my way home, and he said, hey, you need to call the dentist because she just called me. And I said, okay, why didn't they just call me? Why are they calling my husband's phone? I had to look up their number, and I called them, and the lady on the phone said, oh, okay. She said, well, hang on a minute. Let me put you on hold. So they said, oh, she was just calling to verify your husband's appointment. Well, why didn't they just do that with him on the phone then whenever they called? Because they said it was for me. She said, I'm not sure, honey. She said, but that's the only thing that we can gather why she called. And I said, okay, all right, well, I'll make sure that he makes it to his appointment. So he's got an appointment coming up in May for a cleaning, I believe. And so I got home. I told my husband, I said, they didn't call for me. I said, they actually called for you to confirm your appointment. And he said, no. He said, it was the actual dentist that called, and she said, is Kimberly there? This is Dr. So-and-so. And I was like, oh my gosh. So I got back on the phone again, and I called, and I said, hey, my husband stated that it was the actual dentist that called asking for me in regards of something, but she did not explain what it was about to him. So she put me on hold, and she got back on the phone, and she said, no, she didn't call. She said she hasn't called you yet because she still has to get in touch with your orthodontist. I said, my orthodontist for what? Well, to see about having a consult done about your wisdom teeth being removed. I said, I'm not having my wisdom teeth removed. I'm keeping my teeth. So she said, okay, well, this is a mystery because according to her, she did not call. Now, guys, come on. My husband is not going to make something like that up, you know? Anyways, I said, okay, I mean, no news is good news. And she was like, no. She said, if she called, then we definitely need to figure out what's going on. And I said, well, just call me back if you figure it out. So I got off the phone with her, and I just kept pondering on it over the weekend, and I kept thinking, I was like, okay, their communication skills are really bad. She don't want to fill a wisdom tooth. She wants to just extract it. She seems a little invasive with dental work. On that note, I just made the final decision yesterday. I said, you know what? I'm just going to call the other dentist back because they did do a cleaning with me being an ortho, even though they didn't do the x-rays. But hey, I've already had the x-rays done. So I can just point out these new cavities and see what they say and get them filled, or scheduled to get them filled once I'm out of ortho treatment, aside from the wisdom because it doesn't have a bracket going to it. So that doesn't pose an issue being in braces to get that one done. Another thing that kind of turned me away was I had asked her about the bonded retainer that I'll be getting on my bottom row of teeth. I was just simply wanting her professional standpoint, opinion, you know, her being in dentistry, you know, and having patients that have been in braces before and probably have a bonded retainer. I just wanted her standpoint and like her view of, you know, will I be more at risk for plaque buildup and cavities and things like that. And the only thing that she said to me was, if this is something your orthodontist is wanting you to do, then you need to do it. She said, I can't really say anything else about that. She said, this is between you and your orthodontist. And I'm like, I never said I wasn't getting the bonded retainer. I am definitely very much so getting it. I just wanted to know from her point of view with other patients, has she seen it where it creates more of, you know, hygiene issues? She never answered my question. So it seems like in the American world that we live in today, some dentists are just quick to say, hey, let's prevent this, let's just pull the wisdom teeth. Then you won't have to worry about them getting infected or getting cavities. Well, what do you want to do with my other teeth? Because they could get infected and they could get cavities. You know, it doesn't make a bit of difference. I would rather go back to my other dentist and do it the old school way, where I'm actually having my needs met. When my wisdom teeth perceive a major issue, I will have it handled appropriately. At that time, my insurance does not cover wisdom teeth extraction. It is actually like $400 and something per wisdom tooth, you guys. And the only way that it'll cover an extraction for wisdom tooth is if it's posing an issue, and it's not. So just because it has a cavity, my insurance isn't going to cover it. It seems to be such a, you know, normalcy in today's world for wisdom teeth extractions that patients are easily convinced and they just go through with it and they do it. I get prevention. Don't get me wrong. I get prevention. My teeth already being there and they're not posing any concerns or problems right now. No infections. You know, I have that one cavity on the one, and it's simple to fix. You know, it seems more work to pull it than to just fill it, and it's actually more costly to pull it than to fill it. So, you know, I'm just being practical here with my financial situation and my comfort. So with all that being said, today I have went to my new dentist appointment, and if you're curious to know what happened at that appointment, keep watching. Hey guys, so I just got out of my dentist appointment. My appointment was at 4, it's 4:46, and I am done. So they did things a little differently this time with my cleaning. They used a water pick, and they went like down into the gum tissue, and then they used their little needle scraper, and they got, you know, a little bit of plaque. She said I did not have that much plaque, just a little bit. And I also had a polishing done, and they went on ahead and flossed my teeth for me. I got a little goodie bag with some of those proxy brushes, which these proxy brushes are so cool. I'll have to show you guys because they're so different than the ones I get from an orthodontist. But the areas that she noticed, and they brought the dentist in, which is the wisdom tooth that has the cavity. It is an occlusal, they called it. I will be having the wisdom tooth filled May 1st, so I'll be in on a Tuesday to get that done, and no issues there to fill it, so that's good. Also, she said tooth number 4, which was somewhere up in here, has a stain, so they're going to fill that. And then the area of here that I was telling you guys about where the bracket was, they, just like the other place, they said it's not a cavity, it's like slow decaying. It's like where the teeth is just breaking off. So they're going to smooth that out and put a composite filling in that when I come back in October for my cleaning, because by then I'll be out of ortho. They wanted to buy me some time just in case I'm in ortho a little longer than usual. If not, you know, I can reschedule and get in sooner to get my fillings done. They went on ahead and noted everything as far as like staining and spots and stuff go, so that when I do come back in and they do my x-rays when I'm out of the braces, they can get a more deeper look at those areas to see if they've gotten worse or if, you know, they've stayed the same, and what kind of filling I'm gonna go with for those. So that's good. And the area on my lower molar, where the blue dot is back there, so in that area where you floss, I've got a tiny brown spot that they said, which I noticed, and the other dentist had pointed out as well. That spot is like a stain where I didn't floss. They're going to go ahead and get that cleaned up for me and fill that with a composite filling also. So not really any cavities except for the one on the wisdom tooth. The other areas is just staining from poor flossing before I got braces, so that is good to know. See, I'm leaving with a smile on my face, and I did not have a smile on my face at my last dentist visit with the other place, so I'm pretty happy that I decided to go back. But my teeth feel so much better. They asked me if I use a floss pick, and I said no, but I've been wanting to, but they're so expensive. But I got a coupon in my insert in the mail last week for like, I think it was $15 off, so that's a pretty good chunk of money off of a water flosser, and I might as well get one since I'm gonna have a bonded retainer on the bottom. But the hygienist did tell me, she said I should see if my orthodontist will bond that retainer to just 2 of my teeth instead of all, because if I do it with all of my teeth, then I'm gonna have to go through each little area to floss. So me asking if they can only do it through like these and these, then I wouldn't have so much trouble flossing. But I'll mention it to the orthodontist. I'll see what he says and what he chooses to go with. But anyways, I'm happy because my teeth are clean, and that wasn't so hard to do. I just don't understand, like, what was the big deal about filling a wisdom tooth and cleaning my teeth? And I had them polished, so they feel much smoother and sleeker. I have to say, that was probably the most relaxing dental cleaning I've ever had. Alright guys, I will talk to you again for another braces update. Until then, take care friends. Bye.